Diabetes Type 2 Prevention for Adolescents by Wk6AssgnSpettelS. Diabetes is a problem with the body that causes blood glucose or sugar levels to rise higher than normal. This is also called hyperglycemia. Type 2 diabetes is the most common form of diabetes. With type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. In the early stages of insulin resistance, your pancreas makes extra insulin to make up for it, but over time it isn't able to keep up and can't make enough insulin to keep your blood glucose at normal levels. Common symptoms of diabetes type 2 is frequent urination, increased thirst, hunger even though you've eaten, extreme fatigue, blurry vision, tingling or burning in the hands and feet, also known as neuropathy, and slow to heal cuts and bruises. Some risk factors for developing type 2 diabetes are being overweight, lack of physical activity, a diet high in fat and processed carbohydrates, a family history of diabetes, and some races are at higher risk. 30 years ago, type 2 diabetes was rarely diagnosed to people under 40 years old. Now 12 out of every 100,000 children under the age of 20 is diagnosed with type 2 diabetes every year. The number of children aged 12 to 19 that are obese has tripled in the last 20 years. So what's the big deal with having diabetes? Well, it can cause heart and blood vessel disease, nerve damage, kidney damage, eye damage, potentially leading to blindness, foot damage, hearing impairment, skin conditions, and it increases your risk for developing Alzheimer's disease. How do you prevent it? Well, you should be active, eat a well-balanced diet, low in sugar and simple carbohydrates, and maintain a healthy weight. What kind of activity do I need to do? Get your friends involved, play a sport, go for a walk, play Wii sports, ride a bike, go for a swim. The options are endless. Challenge yourself to get at least 30 minutes of activity daily. Make it fun. And what about healthy eating? Start by keeping a food journal daily. It is surprising the things you learn about yourself when you write down everything you put in your mouth. Avoid sugar, such as sodas, candy, cake, cookies, ice cream. If you have to have these things, make it a special treat once a week or less. Increase vegetables. Have them fresh when possible. Eat fresh fruit. Limit your carbohydrates, such as breads, pastas, rice, potatoes, and corn, and limit fried foods. How to maintain a healthy weight? Well, performing physical activity and eating a healthy, well-balanced diet will lead to maintaining a healthy weight. And these are all simple things to do to prevent diabetes type 2.